for the successful conference. Secondly, back to our presentation. The topic which I would like to talk about today, entitled Validity of Polymerase Chain Reaction, PCR, versus coproscopic examination for diagnosing infection with Schistosoma mansoni in low-intensity endemic area in Egypt. Schistosomiasis has been endemic in Egypt since the time of ancient pharaohs, as indicated by the presence of calcified ova in the Egyptian mummies. Egypt is endemic country with localized transmission foci, although control programs are ongoing and have reduced the infection rates. Reinfection is a continuing problem in rural areas due to poor sanitary conditions. The available diagnostic methods are far from ideal, since the microscopic demonstration of eggs in stool, either by cathocates and the formalin ether concentration techniques, lack sensitivity in low prevalence area. To overcome the lack of sensitivity of the parasitological methods, it is necessary to increase the number of stool samples or number of slides prepared from a single stool sample. Other diagnostic alternatives include immunological methods such as detection of parasite-specific antibodies and circulating antigens. These techniques have been shown to be more sensitive than the parasitological examination, but generally lack specificity. In attempt to surpass these diagnostic limitations, Pontus et al. In 2002 described PCR for the detection of S. mansoni DNA in human fecal samples. The amplification reaction is capable of detecting as little as one fragment of a highly repetitive S. mansoni DNA sequence, shows no cross-reactivity with the other related elements, and is 10 times more sensitive than cathocase techniques. The aim of this study was to evaluate the validity of conventional PCR versus coproscopic examination for the diagnosis of S. mansoni infection in low-intensity endemic area in Egypt. Methodology. Study area. The study was carried out in one village in the Nile Delta of Egypt. The study area was selected since most of the recorded cases of S. mansoni infections either originated from that village or in the surrounding areas. Due to inadequate water supply, inhabitants of the village depend mainly on public taps for drinking and cooking, while canal water is used for irrigation and other domestic activities as washing clothes and utensils. School children use canal water for recreation, especially during summer vacation. The village lacks sanitary sewage disposal system. Domestic excreta are disposed through septic tanks in some houses, while those located in the vicinity of the canal water pour their excreta directly into the nearest water stream. The majority of its inhabitants are farmers and fishermen. Study population. A cross-sectional approach was used. Out of 165 children who had no history of anti-parasitic drugs administration in the last months prior to screening, were selected for the implementation of the study. 120 children, about 62% males and 38% females, with mean age of 10 years, range from 9 to 12 years, were able to give 3 stool samples on 3 consecutive days with a compliance rate of about 73%. Stool sample collection and analysis. 3 fresh stool samples were collected on 3 consecutive days from each child in the morning and examined by Cato-Cates technique. A total of 10 slides from 3 fecal samples, 6 slides on the first day of the stool sample, and 2 slides on the second and the third day samples respectively. For more ether concentration techniques, 3 slides from the 1 fecal sample of the first day. 1 sample of the fecal specimen of the first day was examined by PCR. The multiple slide examination was recommended by Enke et al. In 2008 to increase the sensitivity of coproscopic techniques. DNA was extracted from the stool sample using many kits supplied by Intron Biotechnology, Germany, according to the manufacturer structure. The primers described by Hamburger in 1991 were used for the amplification of DNA sequence of S. mansoni. The amplified DNA and DNA leader were separated on agarose gel electrophoresis. The bands were visualized using ultraviolet transilluminator. This show the detection of S. mansoni DNA in stool via PCR. We find lane 1 to lane 6 and lane 8 and 9 were positive, while lane 7 is negative. This in comparison with the negative control and the positive control. Diagnostic gold standard. Since a gold standard test is not available for the detection of parasitic infections, the combined results from the 2 methods, Cato-Cates 10 slides and for more ether concentration techniques 3 slides, were used as a diagnostic gold standard. Results. This table shows that the prevalence of S. mansoni among infected children in the studied area was 40%, 69%, and 81% by formal ether concentration, Cato-Cates, and PCR technique. Also, the geometric mean count by number of eggs per gram stool was 13.3 and 33.3 by formal ether and Cato-Cates techniques respectively. Table 2 shows that 86 out of 120 infected patients was diagnosed by the gold standard, means by coproscopic techniques. This number, 86, was also positive by PCR. In addition, 11 cases were negative by coproscopic examination that were positive by PCR. The Kappa coefficient shows a good agreement. Table 3 shows the diagnostic parameter of PCR versus coproscopic examination as a diagnostic gold standard using diagnostic accuracy tests. PCR shows a diagnostic efficiency of about 91%, sensitivity of 100%, specificity about 68%, BBV, positive predictive value, was about 89% means that PCR capable of detecting about 89% of the infected children whose test results were positive. The negative predictive value was 100%, means that PCR has the ability to detect all non-infected children. Likelihood ratio of positive result was about 8, means that PCR is about 8 more likely to diagnose infected cases than other coproscopic techniques. The likelihood ratio of negative result was 0. Discriminating ability is about 89, and the area under the curve was 0.8. All this indicates that PCR of highly diagnostic performance. Conclusion. The present study has documented that PCR technique is of good diagnostic performance in detecting S. mansoni DNA in stool samples of infected individuals with low worm burden as compared to coproscopic examination as gold standard. The main limitation of PCR application are the technique necessitates the availability of expensive, highly sophisticated equipment and well-trained personnel, in addition to large budget conditions which are not available in low-income countries. Thank you.
Thank you very much. Now we have time for questions. I have a quick, okay, please.
Thank you for a,
Thank
thank you for a good presentation, sir. Is it possible to use this PCR for large numbers of samples if you are dealing with a...
For what? For what, please?
A large number of samples.
Yeah.
If you are dealing with a community with a large number of people, how effective or how cost effective will this PCR be?
It is relatively expensive, but when you are planning to make a control program, you have to use a very specific and a very sensitive test to map the disease in the area. So it is in relation to other coproscopic examination, like catecholates and formal ether, it is very expensive.
Okay, sir. Thank you.
Thank you.
Thank you very much. I think we, oh yeah, one more question right there.
Thank you for a wonderful presentation.
Thank you. Welcome.
Is the PCR specific for Schistosoma mansoni only, or other species of Schistosoma, like Japonicum and Hematobium?
PCR could be used for many parasitic disease, but the primer, it is specific for the S. mansoni. And it is available especially in German industries. Okay?
Thank you very much.
Thank you very much. Thank you very much.